All right. So I think we are live right now, and I'm just going to make sure that it is showing up on YouTube and that everybody is able to see what's going on. Let me just switch over here and make sure. Do, 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 do. That doesn't help if I'm on the wrong channel here. There we go. So, sorry about that. I'm just kind of getting started here. You know, was rushing home from an event, and okay, there we go. So it looks like, and good. Okay, so it looks like that's working. Let me just pull it up over here and make sure the sound is working. See, this is what bothers me is it should show the live stream on my home page when you go to my channel. Making sure my audio works. Okay, good. Okay, my audio is working. Good. I'm going to quick post this to Tumblr and Twitter. And Tumblr is going to be difficult, like it always is. There we go. And now I'm going to post to Twitter. Sorry, y'all. You guys get to kind of come along with me on um, getting all this stuff done. Normally, I've got all this stuff queued up before the live stream, but I got caught up at the event that I was at right before this, and so let me do it as a retweet of my previous tweet. All right, live posted. I'll post everything on Parler later. I don't think I have anybody who comes from Parler to watch live. So just that. Okay, looks like I've got everything up. Cool. Okay. So I am going to start doing Saturday live streams just because, and as I'm going to talk about in today's stream, schools are reopening, including the school that I'm at, that I work at least sort of. And I'm going to talk about the reality of what that actually looks like because it's a little ridiculous. But anyway, the point is, I actually do have to be on campus now. Which means that I can't do Mondays at 4 anymore. So before, when it was all virtual, I was off work by 4 o'clock, and I technically still am. I'm just not home by 4 o'clock now. I was at home, so I was off work and I didn't have to commute. Now I have to commute. So 4 o'clock doesn't work. Um, and just, I can't necessarily be consistent on Mondays anymore. So we're looking at Saturdays. Saturdays are pretty consistent. Today I was running late, but I at least started the stream on time. So there's that. I'm not late on the stream. But I know it's kind of short notice for a lot of people, so I know I'm not expecting a whole lot of people to watch live right now. Um, and but I do just want to like talk to y'all, and I'm kind of essentially just I'm doing this live stream, but obviously people are going to watch this later, and I just want to kind of put some stuff out there about my thoughts and what's going on because it's been like 2 weeks or more since I've last streamed, and so I just want to like check in with y'all. So first of all, let's talk about schools. I know I think I put tests first on the title, but I'm going to talk about schools first just because it's on my mind and it's what I'm dealing with right now. It's my life right now. So, um, So I teach in a middle school. For those of y'all that know that, obviously I'm not going to give my district or specific school because y'all don't need to know that. What I am going to say is that we are doing what I guess you could call a hybrid reopening. We have students who are still learning virtually. We have students who are on campus. But what frustrates me is the students who are on campus are not actually learning face to face. So a lot of parents, a lot of people in the community who want in-person school. You know, you talk to parents who are like, when are we going to reopen schools? When are we going to get kids back? And then they hear their schools reopening. Yay! Like you can be back on campus. And it was part of my job before school started to call parents and ask them whether they wanted their kid to be in person, excuse me, or online or virtual. And what that the way that the questions were worded that I was supposed to ask and the way that that was presented to parents, it gave parents this false idea. I'm sorry, I'm just going to kind of reposition myself here. It gave parents this false idea that school was reopening for kids to come back and learn in school like they did in February of last year or in August of last year, you know, that we were going back to normal and that maybe with masks, maybe with precautions or whatever, but that we were going back to normal or fewer kids in a classroom, that sort of thing. When parents understood, when we finally did explain to parents what it was truly going to look like, a lot of parents pulled their kids out, and that's because the reality is the kids who are on our campus are, you know, they're in person, they're physically present, but they're still learning virtually. So the better description is on campus virtual learning rather than like on campus versus virtual learning, because both groups of kids are learning virtually. Like there is no face-to-face learning that is happening on our campus. And parents thought that's what was going to happen. Kids thought that's what was going to happen. And it was just so hard to like break that news to them that no, that's not what we're doing here. And just for them to be like, well, that's what I signed up for. So no, I don't want to do that anymore. So the kids are coming in. And these are 12-year-olds, 13-year-olds, 11-year-olds. They're coming in. They're going into a classroom. They're getting their breakfast on the way. If they're getting breakfast, they're picking it up in a little bag and taking it. You know, they don't get to sit down and eat in the cafeteria. They're going straight to a classroom. And there's, you know, varying numbers of students in the classroom. My classroom has 3 students. I have 3 students in my classroom. Some have as much as 15 in larger classrooms where they can be spread out because they have to be 6 feet apart. They have to have their like 6 feet of space or whatever. And we're supposed to do, and I know we can't like totally do this in every classroom, but what they asked us to do was have the students sitting in their desk facing the wall. So, which sounds like something you do for a kid who's in detention, right? Like you make them sit facing the wall so they can't talk to their friends. This is what we're doing for everybody who's on campus because, you know, we're treating them all like they're in detention. They have to sit facing the wall and they're on their Chromebook, their computer, their laptop, they're on their device. You know, there's different students using different devices, but they're on their device with their headphones, participating in the virtual learning that we were already doing. So then I'm sitting there at my teacher desk not teaching those students. I'm not teaching the students who are in my classroom, although I have some of them in class in my classes, but I'm sitting there teaching into my computer just like I was at home for the first couple weeks, and I'm teaching them. And so sometimes I do have like a student who's literally physically in the classroom. They're physically right there, but I'm teaching into the computer and they're hearing me both in person and they're hearing me through their headphones, which is weird and it's just more confusing. And it's just this like it's this just bizarro world like thing that just does. I'm like, why are we doing this? I mean, it's a daycare. And we literally have parents who are like, oh, I'm going to drop my kid off today. I'm not going to drop him off today. Like they're treating it like a daycare where they can just drop off their kid whenever. It's like, that's not what I signed up for. And, you know, I used to teach elementary. I moved to middle school because I wanted to teach and not be a babysitter. I wanted to actually engage with students intellectually and get them thinking and engage their curiosity. What I enjoyed leaving behind, what I didn't want to do anymore was the stuff like walking them to lunch and walking them out to recess and watching them out at recess. Like all those kinds of things, like where I had to be supervising them all the time. I couldn't just like, all right, class is over. Bye. Have a good day. Let, you know, go. all that stuff is back now. So now I have to walk them to lunch. They get one outdoor break during the day in the afternoon. Like I get to take them outside for 10 minutes. They can't, they still can't come within 6 feet of each other. They still have to have their masks on. Oh, and they have to have their masks on all day. All day. They have to, I have to have my mask on all day. My goodness gracious. Um, they have to have their mask on all day facing the wall. They're sitting in their desk facing the wall. They have to have their mask on. If they're eating, they can have a snack break, like for a 10-minute snack break once per hour at most. I mean, that's like not like the kids are taking a snack break every hour, but the point is that they can't just constantly be eating. Like they have to have like a defined 10-minute snack break. And they can take their mask off for that. For excuse me, they can take their mask off for that, but they can't. But they have to have the window open, like so that we can circulate the air. It's nonsense. It's absolute nonsense. And this is not school. This is daycare. This is babysitting, and we're not even like an engaging daycare babysitting environment. It's like we're providing a space for your student to work on their assignments virtually and attend their virtual video conferencing classes where we're supervising them. We are an adult in the room so that nothing happens to them while you go to work, and that's the majority of who we have is kids whose parents need to go to work. They gotta go. They can't leave their kid at home, and we have students who do get left at home, and I mean they're 12, 13. A lot of them can be left at home for parts of the day or even an extended period, and they're okay. A lot of them are mature enough to handle that. But you know, we're not providing in-person education. It's not happening. And if anything, like when the kids were at home, they could go to the bathroom when they needed to. They could get a snack when they needed to. They could take care, like if they needed to get up and run around, if they need to go out in their backyard and run in circles to get the energy out, they could do that. They can't do that here. Like they have to sit in this chair with the mask on and face the wall. It just sounds like a prison, and it is. It's like, we get our 10 minutes of yard time, supervised yard time. They can't touch each other. They can't come within, 6 feet of each other. They have to have their mask on. They can't play catch with a ball. Like we can't play basketball. They can't play catch because you can't both touch the ball. Like you can't even like stand at a distance and toss a ball back and forth because then you're both touching the ball and you might get COVID whew. And all of this, and I will get to the tests in a minute because all of this comes from this testing. And I'm going to put this link in the description when I'm done with the stream. But, and I might just go ahead and just let me make sure. Okay, I think everything's fine on the stream. So I'm just going to minimize that. And I'm going to pull up this article. And I don't know if I talked about this. I don't know if I talked about this my last stream. It's been a couple weeks. It was at the end of August that this article came out. And so I can't remember if I had an opportunity to share it with you when that happened. Because, yeah, I probably didn't because I know it was like Labor Day weekend that we had. Okay, something like that. I think I might have shared it, but I'm going to share it again anyway in case I didn't share it, and we're going to do that. So let's see. We're going to add a screen share feed here, Chrome tab. Okay. Sorry, I'm like narrating my setup here. Boop. All right. So the article is from the New York Times. This is the New York Times. This is not a alternative media. This is not a fringe anything. This is the New York Times. And hey, while I'm at it, while I'm fixing things here and setting things up, let me put my lower third on that I normally. Oh, no. That's not what that was. Okay. There we go. All right. So there's my lower third. Cool. With my Tumblr and Twitter and support channel at Coffee. So yeah, and if you guys haven't done so already, you're watching this video, whenever you're watching it, please do hit subscribe and get the little notifications because I know I'm changing up when I stream, and this way you get notified. So if I change up when I stream and you don't see me post on Tumblr or Twitter about it, you can still catch the stream. And also, if you want to support me on Coffee, and also as I mentioned before, I think I mentioned it last time I streamed, but I do pyrography commissions, wood burning commissions now. And so I will also put that link in the description later. So if you're watching this later, it should already be there. And I'm open for commissions, and you can see some pictures on my Tumblr blog, and also I think I have some pictures on the commission form that you can see what I do. But I just recently had my first commission and sent it off, and the person received it and was like, "This is awesome, thank you." And so I'm like, "All right, yay, I did it." I'm like successfully, got paid to do art. So I successfully have done that. So that's an accomplishment in my life now that I got paid to do art. So anyway, that's the thing. Back to this article. Your coronavirus test is positive. Maybe it shouldn't be. And I saw this article, and I saw this headline, and I'm like, what are you talking about, New York Times? You are the like pro CDC and testing and virus, and we need to lock everything down, and Trump didn't do enough, even though he cut off travel to China, but that was xenophobic, so that doesn't count. Anyway, this is New York Times, right? This is not some fringe site. This is not some, right wing or anti-vax or anything. And I'm not saying those things are bad things, but I'm just, I may do a video, or I may even talk about in this live stream if I feel up to it. Talk about vaccines a little bit, because my position on vaccines has been evolving, and and I want to, I'm kind of getting new information and learning things, and my opinion on vaccines isn't what it was maybe even like a month ago. So I may talk about that today or in another stream. But so it says, okay, the usual diagnostic tests may simply be too sensitive and too slow to contain the spread of the virus. Not to mention the fact that it's not really a test for the virus. But anyway, like, it's not, the test that they're using is not actually a test. It was not designed to be a test. It does not function as a test. It does not meaningfully test for anything that's useful or meaningful. Like, the results of the test are meaningless. And that's what the article here is going to say. They're going to try and, wrap it in language that makes it sound like, well, we should still test people, even though the tests are useless, and we're admitting that they're useless. But this article, even, once you get past all their euphemisms and language and choices and stuff that they do to obscure the truth, like, if you actually read what the article is saying, how does anybody still taking this COVID thing seriously? How is anybody still treating this like that this is the big, bad, scary thing that we need to be afraid of right now? And it's like, oh, well, people have died, and I'm going to talk about that. And yes, people have died. People die every year. There's always people dying. And we're going to talk about why this, I don't think it's from this, right? Like, there may be other things that are happening, and people, yes, are dying, and we should mourn those deaths, and those are tragic. But when we talk about coronavirus and we talk about COVID-19, that the entire narrative that has been fed to us is wrong. It is false. And the New York Times admitted it, and everybody just went on. And nobody stopped and went, wait a second, New York Times, what are you saying? If you're saying what I think you're saying, then this whole thing should be over. We should be moving on with our lives. But no, we are so brainwashed already. We've accepted this, that it's just the default, like, you're just the assumption that this is true and that this shouldn't be questioned, that if you question it, you're anti-science or whatever. It's like, no, questioning this is pro-science, because I'll show you why. So here we go. So, and I like this caption here, because this caption really does summarize the whole thing. So, like, if you needed the TLDR version of this, tests authorized by the FDA only provide a yes/no answer to infection and will identify as positive patients with low amounts of the virus in their bodies. And that is essentially what this article is going to say, that just because you get a positive result on this test, that this test is able to trace amounts of SARS-CoV-2 or whatever whatever they're calling it now. Just because it can, the test, the quote-unquote test, it's not really a test, can identify it, doesn't mean you really have an illness, right? So the question is, it's not so much do you have the virus, it's do you have an illness, and are you contagious? Can you transmit this virus? And there are a lot of theories out there about that are kind of challenging the way we think about viruses and germs and infections.
that, it's less about whether or not you have a virus in your body, because we all have viruses in our bodies all the time. We have all kinds of little trace amounts of different viruses. There's stuff you can talk about viral load, but what we're seeing it with this coronavirus thing that, and they told us from the beginning that it primarily affects people who have pre-existing conditions. And so there's kind of a school of thought when it comes to illness and disease and health out there, called the law of the terrain. And it really is just this idea that, the virus is not what's making you sick, right? Your body might be interacting with this virus or with this germ or with this, bacteria or whatever it is, but it's the terrain, it's your body, it's whatever your pre-existing health conditions is, it's whatever mineral or vitamin deficiencies that you have, nutrient deficiencies that you have, that are allowing the virus or the bacteria to kind of take over or to act this way. And so that because you take the same virus or the same bacteria and you expose 10 people to it and you get 10 different results. Well, then the commonality here, or the determining factor is not the virus. I'm going to talk about this too with just coronavirus symptoms. And I'm just going to Google coronavirus symptoms. So, and here, I'm just going to show you what Google says. And there we go. Okay. So I'm just gonna do this where I have it's sharing my window so that I can easily, and you can kind of see, my little links up here. Okay, anyway. So this is just I just go to Google, right? And here are the symptoms. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle body aches, headache, new loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, diarrhea. And so all of these symptoms can be explained by so many other things. There's so many things that can do this to you, or any one of these symptoms. So because you don't have to have all of these symptoms. They'll tell you that. You don't have to have all of them. You only have to have one. If you have a fever, they think you might have COVID. If you have a cough, you might have COVID. But there's so many things that can cause a cough, so many things that can cause a fever. One of the things they ran into this spring and summer was Lyme disease. Lyme disease has similar symptoms, or has symptoms that can be mistaken for COVID, and people are getting misdiagnosed, and it's because of these tests. But if you have one single virus, that can supposedly cause any combination of these symptoms in any amount or intensity or whatever in a wide variety of people, and some people cause no symptoms, then the determining factor is not the virus. Because if the virus were the determining factor, then we would all have the same symptoms and we would all have the same reaction, maybe with different degrees of intensity, but we would all be basically having the same experience if it was the virus. But the law of the terrain would say that it's not the virus that's the determining factor. It's your health and your body that is determining whether you get sick, and this virus is maybe just interacting with your body or whatever, or if it's even part of it at all. But that's the thing which we're going to get back to, is this test. So the whole thing is based on this idea that, all these people were sick. Where's my finger? Where's my hand? There we go. All these people were sick, and they tested positive. And they had these symptoms. So we create the symptom list because we looked at all these people who had symptoms and had a positive result. But how many of those people really had some other illness or had something else going on with their body, and the virus was not even a factor? And because what this tells us, so it says the most widely used diagnostic test for the new coronavirus, called a PCR test, provides a simple yes/no answer. So you test positive, you test negative, but PCR isn't even really meant to be a test. What it does, it's replicating the virus. So you're taking the sample that, you swab up your nose and you put it in the sample. And what they're doing is they're taking all the viruses and things and they're replicating them over and over, just doubling them exponentially. And for a certain number of cycles or for a certain number of whatever, until there's enough that you can look and see what's in there. But PCR is not meant to be a test. It's meant to be a way of increasing the amount of the virus so that you can study it, so that you can manipulate it, so that you can work with it in a lab environment. It's not meant to be diagnostic. And the package on the test, like the test packages actually say this should not be used as a diagnosis or as a diagnostic tool for COVID or for SARS-CoV-2. This does not diagnose you with SARS-CoV-2. Well, then why are we using it as a test? And JP Sears did a hilarious video recently that talks about that. I just realized I think I'm giving you 2 sets of audio, and I apologize.
Okay. Hopefully that still works. Looks like I'm still getting audio there, and I'm not giving it to you twice. Okay. Hopefully that was not too weird. Sorry about that. Um, the so anyway, so JP Sears did an awesome video on this, and he talks about, you know, why this is not a test. It's not meant to be a test. Um, but the other thing is that what they're finding, even if you treat this like it's a test, if you're going to have a test for a virus, it has to be standardized. If you have a test for anything, it has to be standardized. You have to say, okay, this result means this. If you get a yes result, it means whatever. Otherwise, if you don't have a standard meaning for a standard definition for positive, if you know, positive can mean one thing for one person and another thing for another, then it's useless and it's meaningless information, right? A positive test result is meaningless unless there's a standard definition. And the problem with this is, you know, you can take that sample and you replicate that sample enough times, you can give anybody a positive result because you can blow it up and blow it up and blow it up and find something, right? And find, okay, I think that's a little bit of, you know, and you find something. And so if you run the cycle enough times, and that's what they're going to do here. Here we go. It amplifies genetic matter from the virus in cycles. The fewer cycles required, the greater the amount of the virus or viral load in the sample. The greater the viral load, the more likely the patient is to be contagious. So that's this right here. And so the idea is that if you don't have a standard way of processing this, then all you're getting is a yes no answer, and it's not telling you how much of the virus you have. And what they're saying here right here is that it matters how much is in your system. That if you have a lot of the virus, if you have a large amount of the virus, then you're more likely to be contagious, you're more likely to be ill, at least as far as they understand right now. And that may not even turn out to be the case, but that's what they think right now. That's what they're basing stuff off of. And they're saying that if you don't have a large enough viral load, you're not contagious. And our whole lockdown, our whole masking and 6 feet apart and social distancing, all of that is based around the idea that you can be asymptomatic and contagious, that you don't have symptoms, you're not sick, but you have the virus and you're spreading it. And that whole concept of being asymptomatic and having the virus is based on the concept that that if you test positive for the virus, if you take this test, it comes back positive, you have the virus and you can spread it. But what if you take the test, you get a positive, but you have such a small trace amount of the virus that you're not contagious? Well, then the test is useless, and that yes answer, that positive answer, means nothing, and does not mean that you need to quarantine, does not mean that you need to isolate, doesn't mean you need to shut everything down and tell everybody you were in contact with like you spread an STD, like they're treating it like an STD. You know, it's like, oh, you tested positive for HIV, you tested positive for chlamydia, you tested positive for whatever, and you have to go tell everybody who you were in contact with. And if like, it's like, you're calling up your partners or whatever and to say, hey, by the way, that's what they're treating this like. But it's like, that's not what's happening. That's not the reality. Because what we're finding is just because you test positive doesn't mean that you're actually spreading it to anybody. You can have such a small trace amount of the virus and still spread it. So what it is, this is the thing, the number of amplification cycles needed to find the virus, called the cycle threshold. So how many cycles did we need? How much virus is really in there? Is never never, never, never included in the results sent to doctors and coronavirus patients. Although it could tell them how infectious patients are. If our whole thing is about slow the spread and flatten the curve and stop the spread, just because they stopped saying slow the spread, now they're saying stop the spread. We have to stop it altogether. We can't have anybody ever get sick ever again. If that's our goal, then why would we not tell doctors and patients how much virus they have? Why not include those results and say, hey, yes, it came back positive, but you needed, 50 cycles or 9 or however many cycles in order to find this virus, and really you should have only needed this many. And so you're not really contagious. Like, yes, you've been exposed to it, but you're not contagious. You're fine. You can go back to work. You can go hang out with people. If anything, maybe your body's already built up immunity to it and you're fine. Like, whatever. Um, and like, if they would include that information, I think we included that in the statistics when we talk about new cases or new exposures or new positive test results or whatever. If we talked about how much viral load, if we included that in our statistics, I think we would get a very different picture of coronavirus in this country. And I think the lockdowns would have to be over. And there's a reason why this article got buried on a weekend. In the New York Times, it got buried on a weekend. It buries the information here in the article. And it makes it sound like, oh, we just need better tests. No, the whole point is that the virus is not what we thought it was. So in 3 sets of testing data, so here we got 3 sets of testing data that include cycle thresholds compiled by officials in Massachusetts, New York, and Nevada. So like New York, which we were like, oh my goodness, they have so many cases. They have so many people with coronavirus in New York. And Massachusetts, which has all these crazy lockdowns. Like if you watch Liberty Doll, she's been talking about this because she just left Massachusetts. Thankfully, she's out of Massachusetts now. But she was in Massachusetts dealing with all their nonsense. But like in Nevada, which I know they've got their own issues and whatever, but up to 90%, 90, up to 90% of people testing positive carried barely any virus. 90%. Do you understand what that means? 90% of people who carry the virus, who tested positive, were not carrying enough to be contagious. So all of those people were told that they had to quarantine, that they had to self-quarantine, that they had to isolate for however many days, 10 days, 14 days, whatever, before they could go back to work, before they could go out and see people again, before they could go to the store. They had to isolate. They had to order delivery. They had to get their groceries delivered. They had to, do no contact, nothing, for 10 days, 14 days. But they didn't really need to because they didn't actually carry enough of the virus to actually be contagious, to actually have enough to spread it. So then here's the thing. Here's my thing. We look at that other article that talked about 94% of people who died from the coronavirus had other causes of death listed. How many of those people truly had the virus? Out of that 94% of people who had other causes of death, how many of them truly had the virus to the extent that it was actually contributing to their illness? And how many just had that little trace that was enough to test positive and it really had no impact on their condition, and that their death was caused by the other causes only, and the COVID was only added on because of these bad tests, these fake tests. Fake tests. Hashtag fake tests. Like, when we talk about 190,000 deaths, how many of those truly had COVID, and how many of them are other issues? And here's the thing, because you're going to tell me, you're going to say, pro life, for liberty. This is, you're not respecting those families that lost somebody. Here's the thing. How is it respectful to those people who died? How is it respectful to list the wrong cause of death and to use their death to push a political agenda? How is that respectful to them? How is that respectful to their family? If somebody dies of heart disease, how is it respectful to put the COVID label on instead of the heart disease label? Because then we're not learning. Because if we're mislabeling deaths, if we're labeling them as COVID when it was really cancer, it was really heart disease, then we're not getting true data on those other illnesses. And we're not saying, hey, look, here's the issues that we're finding. And we're getting bad data, and bad data leads to bad policy. So to say that to respect the people who died, we have to lie about what killed them, that makes no sense. So yes, 190,000 people died in in the United States, in addition to all the other people who died of who didn't have the COVID label on them, which I don't even know how many that was because they were putting the COVID label on everybody back in like April. If how many of those people actually had COVID, and how many of them had something else, and how many of their families were lied to because the hospital got money. The hospital gets additional money when they have COVID cases, and specifically when they have COVID deaths. If they have X number of COVID deaths, they get more funding. COVID deaths, not COVID recoveries. You don't get more funding for COVID recoveries. You get more funding for COVID deaths. Think about that. Think about a profit motivated hospital, or even just a hospital that's trying to make ends meet, and we could use that extra money. So let's label all these people COVID. We'll run this test and we'll run it through enough cycles that we get a positive result, even if it means, because here we go down here, it says, um, so one solution would be to adjust the cycle threshold. So they talk about the cycle threshold here. Most tests set the limit at 40 and a few at 37. So, and then down here it says a threshold above 35 is too sensitive. So they're setting it at 40, right? They're setting the threshold at 40. And some of them probably could set it higher. Some of them could set it at 45, like it has to find it in 45 cycles, which would mean that you could test just about anybody because we've all been exposed to this. Here's the thing, it's because this virus was first started to circulate back in November and December. We didn't hear about it till January, or maybe late December, early January, but it was already circulating before that, and people were flying back and forth between China and Europe and the US and everywhere else. The virus was already in our community long, long before we ever had a confirmed case, because you can't have a confirmed case unless you have a test. So we didn't have a confirmed case until we had a test. So to say like, oh, well, we didn't have the virus in the US until this time. No, the virus was circulating. We just weren't testing for it because we didn't know. So we've all been exposed to this virus, and pretty much everybody, unless you are some super isolated person out in the middle of nowhere and have had no human contact in the last year, you've been exposed to this, and you probably have some trace amount of this virus in your system. So with enough cycles of this PCR process, I'm not even going to call it a test, we could find the virus in you too. We could get you a positive result if we wanted to, if we want to run it through enough cycles. And so if you are a hospital and you're trying to make ends meet, you're trying to pay the bills, you're trying to pay for supplies for your other patients, right? Not just your COVID, but your other patients who need things. And you get told, well, if you have X number of coronavirus deaths, you're going to get extra money. Well, then, okay, I'm going to go to the hospice ward. I'm going to go to the cancer ward. I'm going to test all of them for coronavirus. Or I'm going to test all my patients for coronavirus, right? And we're going to run it through enough cycles that we get enough positive results. Oh, look, I've got all of these, cases. And number one, I've got all these cases. So look, I need more resources. I'm asking the parent, if it's a hospital that's got locations in various places, or it's part of an association, like, hey, I need more resources. Or you're going to the state, or you're going to the federal government saying, hey, I need more resources, or to the board, I need more funding, whatever. So you get all these cases, you get more funding, you get more supplies, and then you're going to have deaths because you're a hospital. People die in the hospital. People die from cancer. People die from surgery complications. People die from all kinds of things. But if they were labeled COVID, now they're a COVID death. So now all those deaths that normally are, the worst, that are the worst day or worst thing that can happen, for a doctor or a nurse, it takes a toll on them when people die, right? It's harsh. It's sad. It drains you when you lose a patient as a doctor or a nurse. And it's draining. It's awful to do that. But here's the thing, if you know, yes, it's awful, we lost that patient, it's so sad, what could we have done better? But you know what? At least because they were labeled COVID, the hospital's going to get more money so we can help the next patient. And that's, and you can rationalize things and justify things that way and say, well, at the very least, something good will come out of it, right? The very least, we'll be able to get more funding so we can help the next patient. So why wouldn't a hospital, because they got their own testing labs, they have, or whatever lab they send off to, we're going to set the threshold at 40, we're going to set it at 45, we're going to set it at 50, right? But they're saying anything above 35 and that a reasonable cutoff would be 30 or less. So most labs, again, most tests set the limit at 40. So if you go get tested, they're probably setting that limit at 40 or 37 or something like that. But the scientists here, the experts, right? Listen to the experts, cited by the New York Times. It's not even like some fringe doctor. These are the experts cited by the New York Times. And they said, we need to set the limit at 30 or 35. Here's the problem. There's no standard. All these different labs are running this test, and there's no standard. So the tests from this lab mean something different than the tests from that lab, because this lab over here, they're running it at 35, and this one's running it at 25, and this one's running it at 40, and this one's running it at 50. Those are all going to be different results, and those results are going to mean different things, and they're going to be useless information unless you can clarify how many cycles it took. And so it's just this, and they're not recording the threshold. They're not putting that in the statistics. They're not putting that in the data. And you have to understand that this article shows that the tests are useless. And they said if they cut it off at 35 cycles, and so okay, this is a different lab, right? This is the Wadsworth Center. This is the New York State lab. This is New York State's lab. This is the lab that's been processing all of this. They had 872 positive tests for July based on a threshold of 40 cycles. At 35, 43% of those would not be positive, and at 30, 63% would not be positive. And then in Massachusetts, 85 to 90% of people who are tested positive in July with a cycle threshold of 40 would have been deemed negative. Or with a threshold of 40 would have been deemed negative if the threshold were 30. So all those people didn't really have COVID, right? They didn't really have the virus. So I know I'm spending all my time on this testing thing, but I just really think people need to understand that this COVID is over. I don't think it was ever really a thing. And I think a lot of people got mislabeled, misdiagnosed as having COVID, and they really had something else. And here's the really awful part, okay? Here's the really, really awful part. How many people in March, April, May, and even still today were misdiagnosed because they were given a bad test that detected a tiny trace of a virus that wasn't really what was making them sick. They were being made sick by something else. But because they got that positive result, they were treated as a COVID patient, and they were given whatever at that point in time we thought was the appropriate treatment. In March and April, it was the ventilator. We put people on ventilators and they died. How many of those people never needed to be on a ventilator? How many of those people had another illness, had another condition, had something else going on that could have actually been treated had the doctors taken the time to say, okay, what if this isn't COVID? How many of those people would have lived if they had not gotten a COVID diagnosis because they would have received the appropriate treatment for the illness that they had instead of the treatment for an illness that they didn't really truly have? Because Their viral load was so low that it wasn't really making them sick. How many people died needlessly in March, April, May, June, and still are dying needlessly today because we have not fixed this problem? We have identified this problem. We've done nothing to fix it. Nothing has been done. So when I say we never should have made COVID into what it is today. We never should have locked down. We never should have put the masks on. We never should have done any of this. I'm not saying because those numbers don't matter or the people who died don't matter. I'm saying because some of those people might have lived if we had given them a true diagnosis, if they had truly gotten an accurate result, or if the cycle threshold had been noted and said, oh, well, no, look, you technically have it, but it's such a low viral load, it can't really be what's making you sick. So really, we need to look at other causes. We need to find out what's really going on. We need to get to the bottom of this. But our medical system, our healthcare system does not care about identifying the cause of an illness. They care about managing symptoms and passing you on through. And anybody with a chronic illness, myself included, knows this. Somebody with a chronic illness, you know that when you try to get an accurate diagnosis from your doctor and when you try to get a treatment plan, your symptoms are dismissed, ignored, explained away. Nobody really wants to do the work to dig deep and find the true cause. They want to mask your symptoms. They'll put you on a prescription to say, here, just cover up your symptoms, get yourself through. It's, a stimulant, a depressant, or whatever, just to let you make it through the day. But when you actually identify the root cause of a problem, when you actually identify what the real issue is, then you get real treatment, then you get real help. But that is not what we did in March, April, May, June, July, and still today, in September. We are still doing this where we are labeling people with COVID and saying, that's it, you have COVID. And you might have complicating factors, but you have COVID. And if you die, it's a COVID death. But we know that that's false. We know that's not really the case. And we know that's not how we need to treat this. And yet we're still doing it. And we're not enough of us are speaking up because we're afraid to, because we've been told the narrative and we've been threatened that if we question the narrative, we will be silenced, we will be fired, we will be ridiculed. But people are dying because they're not getting appropriate treatment for the actual illness they have. They're being given a false diagnosis so they can be counted with a statistic that can be used to shut us down, silence us, and make us afraid. So when I say we need to go out in person, when I say we need to lift the lockdowns, we need to take away the mask mandates, I'm not saying it because I want people to get sick or because I'm okay with people getting sick. I'm saying it because we need to actually start treating people for the conditions that they have and diagnosing and getting true answers and stop blaming everything on a virus that appears to not really be doing everything that we thought it was doing. Now, here's the thing. If it turns out that every single one of those COVID deaths, if every single one of them truly did have a high enough viral load that it really was their cause of death, okay, let's get that data. But that's not what this data is saying. This data is looking at those test results and saying, look, 63%, 80%, 90%, depending on the threshold that you set. So you set a higher or a lower threshold, the number changes. Well, what's the reality? And so it sounds like they need a lot more information about, well, how much of a viral load is necessary for it to be contagious? How much of a viral load is necessary for you to be ill, for it to be considered the actual cause of your illness? Do they know that? They don't. They don't know. They're guessing still. Even these scientists here in this article here, okay? These scientists right here, they cannot agree on a number, on a value, on a threshold. They can't agree. They're debating the threshold, and this was posted at the end of August. We are 6-7 months into this. And they don't know how much virus you need to be contagious, how much virus you need to actually be ill for it to be considered part of your illness versus just a trace thing that doesn't have any impact on why you're actually feeling sick. And if you're asymptomatic, does it just mean that you don't really have the virus? You have such a small, tiny amount that you're not really contagious and you can go about your life. And the scientist says, I'm really shocked that it could be that high. The proportion of people with high CT value results. Boy, does it really change the way we need to be thinking about testing. This was weeks ago. Have we changed? Have we changed how we think about testing? Has the narrative changed at all since the end of August? No. If anything, it's gotten worse. If anything, it's more wear masks and get tested and we need a vaccine and all of this stuff. And I know it's almost like I've almost been on for an hour, so I don't know if I'm going to talk about vaccines today. I might do that next week. But I kind of want to. No, because I promised I was going to talk about how to be prepared for November, so I am going to wrap this up. I'm going to talk about how to be prepared for November. What else? What else did I say? What else did I say that we were going to talk about? I said, let's see. Okay, yeah, no, I talked about reopening schools and how it was stupid, and how reopen schools. When schools say they're reopening, are they really? Um, and it's just ridiculous. And we need face-to-face learning. We need normal in-person face-to-face learning, and this half and half thing is not working. And I talked about the tests, and I'm going to talk about how to prepare for November. So this is going. I mean, I'm talking about this on my channel a lot. Um, I'm talking about this to people in person, friends, family members, people. I was at an event today for pro-life stuff. It's basically a volunteer training for 40 Days for Life. So 40 Days for Life starts this Wednesday internationally. So there probably is a 40 Days for Life location near you. It's international. So go to 40daysforlife.org. I don't want to give you the wrong com. Yes, 40daysforlife.com. 40daysforlife.com. And I'll put that in the description as well. And join your local campaign because we do really need people. The campaign is on. People are going out in person in front of abortion facilities with or without masks, your choice. Or, I mean, I don't know, some states might, with stricter mask mandates, may tell you need to wear a mask. But I mean, if you're 6 feet apart from people and outside, even under the ridiculous mask guidelines that are nonsense, even under those, you don't have to wear it. You shouldn't have a mask on if you're more than 6 feet apart and outside. Whatever. Anyway, so at least where we are, and at least as far as like international guidance or whatever, you don't have to wear a mask. Um, they are social distancing, but we social distance during 40 Days for Life in normal years, so it's not really a new thing. That's not really a COVID thing. It's just like this is how we set up because we try to spread out because we want people to be able to have their own space and everything. But anyway, 40 Days for Life. You go out on the sidewalk. You pray for an hour. You sign up for like 1 hour a week. So like let's say Tuesdays at 1 p.m. or whatever time works for you. I've signed up for 2 different hours just because I can and why not? I have the time, so I have 2 different hours that I've signed up for, and and you go and you pray for an hour outside the abortion facility, and we pray for the women and children inside the facility. We pray for the workers, and we pray for an end to abortion. And it has seen lives have been saved because of this. Because women who have an abortion appointment, they come to the facility. They see the people praying for them. We have trained sidewalk advocates. So you go through a training before you become a sidewalk advocate. I've been through the training actually a couple of times. Like I did it initially, and then I've gone again just for a refresher. Um, you go, and the trained sidewalk advocates will reach out to those women and offer them help and resources. But we've even seen, even when there's no trained sidewalk advocate out there and nobody actually offers the resources, like, people are just standing there praying, we see women choose life even then, just because they're like, somebody cares about me. Somebody actually is praying for me. Maybe I can do this. Maybe I can, make this work, even if it's going to be difficult. So we've seen that happen as well. But the trained sidewalk advocates are definitely essential because they do offer the free help and resources. But so anyway, sign up for your local 40 Days for Life campaign, 40daysforlife.com. So the number 40, like 40 days, and Days for Life, all spelled out, DAYSFORLIFE.com. I'll put it in the description. Okay, I'm putting a lot of things in the description. I hope I remember to put everything in the description that I've said I'm going to put in there. If I said something that I was going to put in the description and it's not there when you watch this later, let me know and I'll add it. Um, but anyway, go to 40daysforlife.com, sign up for an hour at your local vigil. If there's not a vigil near you, if there's not a campaign near you, then at least, take some time in prayer, or, take some time this next 40 days from September 23rd to November 3rd or November 1st or something like that. Just take that time and in prayer and see what you can do. Or, and even if you don't have an official 40 Days for Life campaign, you can still go out on the sidewalk in front of the local abortion facility and pray. You can still do that. That's, that's always a thing that you can do. You don't need 40 Days for Life to do that. But it's worth doing. So anyway, I was at the volunteer training and I just like met a person, like I met several people who, for the first time, who I'd never met before, who are new to, some of whom were new to 40 Days for Life. And like I'm literally just having these conversations with people I meet. Like I literally met this person for the first time and I'm telling her all about my like prepping disaster preparedness and how crazy I am and EMPs and stuff like that. Like I sound like a crazy person. But I'm telling everybody who I meet, I'm telling them all about being prepared for November, because a lot of people are under the impression that this COVID and riots and everything and all the craziness of 2020, it's all just because of the election, which, yes, is partially true, but that it's all going to go away the day after the election. It is not. Y'all, please, please tell me that you don't believe that it's going to go away the day after the election, because number one, election day is not going to look like it has in the past, because we are doing this whole thing with the mail-in ballots. I think we're going to have record numbers of mail-in ballots, and there's going to be an insistence that we wait to count all those mail-in ballots before a winner is declared. So I do not think a winner is going to be declared on election night. When normally election night, you huddle around the TV and you watch, your favorite national news cable channel or local channel or whatever, and they go like, as the results come in and they start lighting up the map in the different states and the different colors. And they're like, oh, we're calling this state for this person. They've got the running total of electoral votes. It's not going to look like that this year. They're going to probably do that, but they're not going to declare a winner. It's all going to be possible. It's all going to be maybe, we think, looks like, it's going to be that, because there's in a normal election year, mail-in votes don't get counted unless it's that close. So you look at it was like the Bush Gore election, I think, where that was like Florida. It came down to Florida, and we were waiting on them to count absentee ballots, and that was the hanging chads or whatever. And it was this whole thing where it took a while to declare a winner, and that was in a still semi-normal election year. With all of this, with COVID and everything, and with more people than ever requesting ballots by mail because they're afraid to go out in person to the polls because of a virus that we don't have a test for, and we don't actually know what it does, and we're not actually able to isolate it as like, okay, here's what this virus is doing versus, what's going on with you and your health individually. But people, because of that, people are afraid to go to the polls. And so we're going to have more people than ever voting by mail. It's going to take time for us to declare a winner. We're not going to be able to declare a winner that night unless it's a huge landslide, which I kind of doubt it's going to be a huge landslide. I think it's going to look a lot like 2016, where it's going to be very close and may even be one of those popular vote electoral vote things again. I do think Trump's going to win. I'm not voting for him. But I definitely don't want Biden to win either. So I'm not voting for either. I'm voting for Joe Jorgensen. But I do think realistically Trump's going to win. I do think that the left is going to protest and riot over this, because first of all, they're going to insist on counting every mail-in ballot. The Postal Workers Union, the USPS Postal Workers Union, has endorsed Biden. So we're going to emphasize mail-in ballots. We're going to tell everybody to vote by mail because it's safer. And then the people who are delivering the mail all belong to a union that has endorsed one of the candidates. We don't see a problem with this. This isn't a problem to anybody. Like this is okay. We're going to trust this. And we've seen it in the past when it has come down to those mail-in ballots. We've seen it where all of a sudden, oh look, we found this whole box over here under a chair of ballots. And look, they're all Democrat. It's always they're all Democrat. There's like one or two Republican ones in there just to throw in. And oh look, all of a sudden we got all these votes. And we've seen it before where there's more votes than there are registered voters. Like, so then where do all these other votes come from? And so you know, we're not going to have a clear cut result. Definitely not on election night. Probably not for a while. There's going to be riots, especially if on election night it looks like Trump is going to win. If election night, because here's what I'm predicting: liberal voters, leftist voters, Biden voters are more likely to vote by mail because they believe all the nonsense about the virus. They believe all the stuff about, oh, voting by mail is perfectly safe and there's no fraud and fraud doesn't exist and whatever. Nothing can possibly go wrong. They believe all that. So they're going to vote by mail because they think they should. So the votes that are going to be in person are going to be more Trump votes. Trump voters are going to vote in person. They're going to vote early and in person. And I recommend that whoever you're voting for, vote early and in person. Vote early, vote in person. Because on election day, I think there are going to be riots. There is going to be civil unrest in cities. There are going to be people in the streets. And there's been talk about the possibility of something else going on that day. If it's going to be a chaotic day, it's going to be a prime target if somebody wanted to disrupt. I would not be surprised if somebody who wants to disrupt our processes, who wants to throw us into chaos, who wants the chaos because they benefit from it in some way, it would be a day to cause chaos. And I know like people are watching for that. So I would just say, please, please vote early. Don't be out there on election day. I would recommend on election day, if you can, either be home or be inside. Like just be safe on election day and election night. If you live in the city, try to get out if you can. Even if it means like staying in a hotel or a bed and breakfast or something out in like a small town or like at least in the suburbs. Like don't be in the city. Don't be downtown on election night. Because what's going to happen is I'm predicting on election night, the results are going to look like a Trump landslide because Biden voters are going to vote by mail, a majority of them, and those aren't going to all be counted yet, where it's going to take time to count those. So we're going to be looking at a Trump landslide, whether or not that's the actual voting results that we end up with, but that's what it's going to look like through the traditional election night coverage. And so people are going to take to the streets and riot because they're going to be demanding that the mail-in ballots be counted and everything, and that all of them be counted, recounts, all those sorts of things they're going to demand all those things. So there's going to be violence in the streets. There's going to be riots, especially if it looks like Trump is winning. And we could see it the other way too. If it looks like Biden's winning, which I don't think it will, but if it looks like Biden's winning, we could see it the other way. And so what we're going to see violence in the streets. We're going to see riots. Okay. And I'm so sorry. I just saw Caleb. Thank you for hopping in the chat there. It says thank you for streaming. I'm glad you're watching. So just wanted to kind of give you a shout out there. I just saw the chat. But yeah, so I'm just saying that like it's going to be crazy that day. It's going to be crazy the following week. It's going to be crazy the following month. Honestly, I think up until a winner is declared for sure and saying, okay, this is the official winner, I think we're going to have craziness. And then even after that, even in the following weeks, even after a winner is declared, depending on who it is, I think there's going to be chaos. I would not be surprised if there is some kind of event that happens that disrupts our normal infrastructure, our normal supply chains, our normal communications or power grid or anything. Like we're going to see disruptions, we're going to see attacks, we're going to see chaos around that time. So here's what I want you to do. I don't want to just freak you out. I want you to prepare. Number one, I want you to have 2 weeks, at least 2 weeks of food and water. If you can store more, store more, but at least have 2 weeks worth because that at least will get you through the initial whatever until you can figure out what to do next, depending on what's really happening. It at least gets you prepared for an initial crisis. So, 2 weeks of food and water. If you can, have a solar power or gas powered backup generator. It can even be just a small one, enough to charge your phone. You can get those little solar power battery banks just in case we have a power outage. Okay. And when I say store food and water, first of all, when I say store food and water, non perishable food and water, stuff that does not need to be refrigerated. Okay. So non perishable food and water. Have an alternate power source like a generator, a solar power battery bank, whatever it is. Have a way of getting charging your phone, charging some basic electronics, even if it's not your whole home, just like some basic stuff. If the power goes out, I would not be surprised if the power goes out around that time, or if we have power outages. And if you're living in California or on the West Coast, you're probably already having power outages anyway. So, you know, you hopefully already have those backup sources. Um, and then again, if you can be armed and defend yourself, please do. Um, really important. And my biggest thing, and I said this already, but the closer we get to November and the closer we get to election day and election night, especially, if you live in the city, especially in a major city like New York City, Los Angeles, Chicago, any of those places, Dallas, Houston, um, anywhere like that, if you live in a major city or even just a regular city, and especially if you live near downtown or you live near the center of the city, do not be in that city on election night. Okay, I'm real serious. I have my plan for not being in the city that night. Okay, don't be in the city that night. There will be riots, especially in the cities that have already seen really terrible riots up till now. There will be more riots, especially if it looks like Trump is winning. You don't need to be there. Pack up some basic essentials. I've talked before about like what to pack up and what, and if you're able to plan ahead and kind of get out ahead of time, you can make sure that you take some basic things. Make sure you have your basic important documents such as your insurance documentation, and your birth certificate, IDs, and all of your papers, basically all of your personal important papers. Make sure you have all those with you, and any irreplaceable items, right? Not just valuables, but irreplaceable items, things that can't put a price tag on. Take those with you if you can, just in case there's fires, in case there's whatever. Um, take that kind of stuff with you and get out of the city. If it's a bed and breakfast, if it's a motel, if it's somewhere out of the city, if you're staying with friends or family, but just get out at least on election day and election night, if and be potentially prepared to be away for a while, for a week or more if you can. If you can't, if you absolutely cannot leave the city, if you have to be in the city, again, make sure you're armed. Make sure you have 2 to 3 weeks of food and water, non-perishable. Make sure you have your backup power source, and just be ready. And then I would say, when you get to that point, I would say turn off the lights that night. If you have the TV on, just have your windows closed. Don't be a target. Don't draw attention to yourself. Remove any political signs you have from your yard prior to election day, or even on election day. Remove any signs that you have in your yard. Um, just make your house as nondescript and non-attention grabbing as possible. Put your cars in the garage if you've got a garage. Just don't make yourself a soft target if you have to be there. And again, be prepared to defend yourself. If you have guns at home, if you're armed and you're trained, have them at the ready, have them loaded, have them ready to go. Um, work on a plan with your family. If you have young children, you don't want to freak them out too much, but have a plan for if you do need to get out quickly, or if you need to be able to hide. And maybe with young kids, maybe make it a hide and seek game. Just like teach them some great hiding places for hide and seek, and then so then if something crazy happens, you can say, all right, we got to play hide and seek. Go to your hiding spot, and that way it's a kind of a little more kid friendly, less anxiety inducing. So you're not kind of freaking them out, but it's like, oh, we're playing a game, we're playing hide and seek, and just kind of practice that with them. And just and this is if you have to stay in the city, and you're worried that people might be coming down your street. So I just wanted to kind of go over all those things, just because I know people come to me and to say, hey, I'm scared. What do I do? What's what should I be doing? Um, but I just, I wanted to throw that out there. So thank you guys, and I know I'm gonna get more people watching this later, so please do feel free to put stuff in the comments. I will be checking those. I just want to, I want to encourage you to, um, ask questions, think things through. If you have questions, you're like, what should I do in this situation? Like if you've got a specific situation and you want some feedback, I'm happy to talk about that with individual people. So feel free to message me through Tumblr, or even in the comments or whatever, and ask about a particular situation. And just if you want my thoughts on it, but be prepared. Don't expect this to blow over on election day. I think it's going to get worse before it gets better. So I don't want to end on that note. That's a real sad note to end on. um, so anyway, let's do something happy and positive. I don't know. If y'all haven't seen, okay, let's do something funny. I don't know if it's happy and positive, but it's at least funny. If you haven't seen the Despacito Joe, if you haven't seen Joe Biden's Despacito moment, um, it was this week. It was like Tuesday, I think. And he was supposed to do is yeah, because it was Tuesday because it was Hispanic Heritage Month kickoff event, right? If you haven't seen this, go look it up. It's on Joe Biden's Twitter, so it's not even like, oh, this is a fake edited video. Literally live streamed on Joe Biden's Twitter account, from Tuesday. You have to like go scroll back to Tuesday, to find it, but um, it's just, so it's this Hispanic Heritage Month, big deal, right? And because he's trying to get the Latino vote, he's trying to get the Hispanic vote, reach out to Puerto Rican voters and voters in Florida who are primarily Cuban, of Cuban heritage, and all of that. And he's and so all the news networks. I was watching. I happened to be watching Fox at the time. Like I watched different news networks. I happened to be watching Fox, and they're like, "Oh, we're waiting on Joe Biden to come speak for this Hispanic Heritage Month thing." And they kept showing it. They're doing other stories, but they had the feed on, and like they're watching for him. And it's like, well, we don't know when he's coming out. He said it was going to be 6:30. Now it's almost 8 o'clock, and blah, blah, blah. And sure enough, it was 90 minutes before he came on, but Fox and other channels had already switched away to other stuff. They'd gone on to their normal nightly programming because they'd given up on him. But it was live streamed. So I went back later because I'm like, did he ever actually speak? Did he ever show up? So I went and looked, and sure enough, he did. So he waited 90 minutes past when he initially said that he was going to be out there, or when his team said he was going to be out there. He's introduced by, I forget the guy's name, but he's the guy who wrote the Despacito song, right? Despacito, that one. Um, so it's the guy who wrote that song, and he's introduced by him, and Joe Biden walks up to the podium, and he's got his smartphone in his hand. Okay, this is just like such, oof. And he holds it up, and he holds it up to the microphone, and he goes, I just have one thing to say. And he goes, hold on. So it's not even like he didn't have it queued up. He wasn't even like prepared to actually hit play at that time. He's like, I just have one thing to say. Okay, hold on. And then he presses play, and he plays, and it's like, and it starts a little intro, and you can't quite hear it, but then it's like, then you hear that it's the Despacito song, and you're like, oh my gosh. And he's just sitting there going, and kind of like dancing or whatever a little bit. And oh my gosh. And so of course it's being memed and parodied to death, and it's ridiculous. But my thing was, like, people are like, oh well, he's being introduced by the person who wrote the song, blah 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 blah. Okay, first of all, it's a meme song. It's a meme. It was already a meme. That's so sad. Alexa, play Despacito. So now I'm saying that's so sad. Biden played Despacito, and posted that meme on my Twitter and on my Tumblr. So if you want to share that meme, you feel free, go find it on my Tumblr or my Twitter and share it, download it, take it, steal it. It's yours. Go for it. Because it's hilarious. And people are calling him Despacito Joe. But my favorite part is the lyrics of the Despacito song. So Despacito means slowly, right, in Spanish. And it's a song that's very it's about sex, right? Let's just be upfront about that. The lyrics are very sexual. It's a man singing to a woman, um, and saying what he wants to do, you know. And it's about him. He's seducing her or whatever. But the first line of the chorus talks about breathing or sniffing, like depending on how you translate it, breathing or sniffing your neck slowly and then whispering in your ear. What do we know Biden? Like we know him from the coming up behind you and sniffing your hair and sniffing your neck and like so just the fact that that was the song and that they chose, you know, all the Spanish speaking Latino Hispanic music that is out there, right? Of all the Latino music out there. You chose a song that first of all was a meme and an overplayed meme, very cliche, very overplayed. It was already the song was already a joke. Okay, the song was a joke. And then you happen to pick a song where the lyrics fit exactly into what your critics are saying about you and making fun of you for, which is the neck sniffing and all of that. And not only all of that, but you couldn't even get your sound team to play it over the speakers. As you could have had it playing over the speakers as you walked up. At least that would have been like a, you know, here's the person who wrote the song introducing, and then Joe Biden's walking out to the music. Now, it still would have been funny. It still would have been a meme. It still would have been ridiculous because of the lyrics and because it's, you know, the song's called Slowly and what it's Slow Joe and all that kind of stuff and whatever. But at the very least, you could play it through the speakers instead of holding your phone up to the microphone and pressing play and like fumbling with it and pressing like. So I honestly think between that and between the now Supreme Court issue that we have, it's now that we're talking about the Supreme Court, I definitely think that we are going to see. Um, I, I don't know how anybody votes. The only way I see somebody voting for Biden right now is because they hate Trump just that much and are just that anti-Trump and Trump derangement syndrome and whatever. Um, and I don't see enough people doing that to counteract the actual enthusiasm from Trump voters. Remember, I'm not a Trump voter. I don't love Trump. I don't really like Trump. I'm not voting for Trump. I'm voting for Joe Jorgensen. I'm just saying, I'm looking at the Trump voters. I know Trump voters. I have Trump enthusiastic Trump supporters in my family and among my friends. I know them. They're enthusiastic. They're not just voting because they don't like Biden. Like they don't like Biden, but they're voting because they actually like Trump and they actually think he's doing what's best for our country. And that is very powerful as far as motivating. It's much more motivating than hatred. Enthusiasm, genuine optimism is so much more motivating than pessimism and fear. And that's all the Democrats have. All they have is pessimism and fear. So if you're asking for my prediction, if you want to know what I think will happen, I do think Trump's going to win unless there's major voter fraud. So, with all that, if you haven't seen the clip of Joe Biden playing Despacito, go find it. It's hilarious. It's ridiculous. And I will see you guys. I'm going to try and do a consistent 12:30 on Saturdays live stream. I'll kind of let you know if I have to change that time, but I'm hoping I can be consistent with that. It's just going to be easier to do now, and I have a little more freedom and time and everything like that on Saturdays. So, and again, yeah, it could change at the last minute if something comes up, but I'm going to try and do Saturdays at 12:30. So, thank you guys for watching. Those of y'all who watched live and those of y'all who are watching later. And I will see you guys next week. Thank you for watching.